everyone. I'm Megan Cullip, along here with Scott Michlin.
Good morning, Megan Cullip. Here we are, week 35.
35.
It's already on the screen and everything.
I know.
Look at that, everybody.
Our loyal listener base.
How about that? Welcome to week 35, Monday, November 9th.
That's right.
Here we are.
Here we are.
Yeah.
Big weekend. We don't have to talk
A lot of stuff going on this weekend.
But
yeah. So there was that.
There was that. So that's a thing.
And big news today about this maybe vaccine coming out.
Pfizer.
90%.
95%. Yeah.
I read 90.
Did you?
So obviously you're
accounts.
fake news. But okay. But very high.
Very high.
Can we agree? Very high.
Yeah.
Efficiency.
Very promising.
But, some folks are saying, that's just the initial test, and these things need a little bit longer to study.
Well, it was that was phase 3 test, and then they give it 2 months before the FDA approves it, and that 2-month mark is actually going to be up by like the 3rd week of this month.
Okay.
So we're closer than we might imagine.
True.
But
don't get me wrong, it's positive.
Seriously.
Right.
Jeez. But it is a double dosage, which could get complex. Now, of course, there's precedence for that. Many vaccines that we do use are multiple doses, but, when you have to rely on the general public to come back twice for a shot.
Right. Well, I think with something as serious as COVID, I think that's a big incentive, don't you?
I mean, is measles not serious? Is hepatitis not serious?
Yeah. And I think we've done a pretty good job of that, haven't we?
We have.
So,
but that took a while, though,
I have
right?
faith. I have faith
ingrain in the culture.
I have faith in humanity. Still.
Good luck with that.
Thank you very much. Okay. Well, anyway, listeners and viewers, thank you for joining us, and we are excited to have you with us. We've got a great show today. A couple of guests are lined up. San Juan Regional Medical Center CEO Jeff Bourgeois is going to be calling in and giving us an update on conditions at the hospital. Of course, unfortunately, numbers are increasing even here in San Juan County and across our state. And so we've asked Jeff Bourgeois to call in to kind of keep us in the loop as to how conditions are at the hospital, how they're dealing with an influx, if they are having an influx of patients at the hospital. So that's coming up as well. And also we're going to be hearing from Maddie Hayden from the New Mexico Environment Department. They are the department that's putting out the state watch list with the businesses. It's part of the health order that the governor unveiled on October 23rd, that if a business has more than 4 COVID positive cases, they will be needing to shut down operations for 14 days. And so that has already happened here in the community. We will talk more about what that means and more with our guests coming up later on the program. So anyway, that's what we've got going on today.
Good.
So we'll start by talking about testing this week. It is happening again, as it does, and so we can kind of show you that the testing is happening here at San Juan College. That was last week. Oh.
Womp, womp, womp.
I hate it when that happens.
Yeah.
Don't you? Oh.
I do.
Darn it, because I could have been...
I mean, I kind of suspect that it might be the same times because we've had a pattern there, but
I wouldn't.
I don't want to spread, I don't want this to be a 95 station here.
Right.
So
here
we go. We're pulling it up right now.
We are pulling it up right now, everybody, so hold on one second while I get put together. But anyways,
yeah. I was going to say what the minks did to us.
Oh,
there's a
minx follow-up?
There's a minx follow-up because there's another mink-like creature that is balancing it out and providing helpful information, and that would be the ferret.
Really?
Do you remember in the 90s there was a big, ferret craze, and people were buying them as pets?
Yes.
Yeah.
So the ferret could save us all.
The ferret could save us all.
Telling me.
Yeah, I'm saying what the minks do to us, the ferrets can make up for. And I feel like they're probably from the same Latin.
They are the anti-minks.
The ferrets are the anti-minks.
There you go. So, well, thanks for sharing.
They're more American.
That's true.
Yeah.
That's true. All sorts of coats everywhere, maybe.
Ooh.
No.
No, I think they're rougher and...
Oh, yeah. Not coat-worthy.
No.
Okay. Testing. Let's talk about testing,
Let's
shall
talk
we,
about-
this week?
now that
And
we
we
got
now
that
have
pulled
the
up.
new
Thank you. Thank
numbers.
God.
Yes. Okay. So testing is happening. Times are a little bit different. See, so I'm glad we didn't go with that.
You're right.
Last
That was-
week.
yeah,
But
we didn't.
today, 8 a.m. to 9:30. So bless them. They're out in the snow. Testing
Yes.
folks this morning, the snow flurries. And then this afternoon, the times are a bit earlier. So 3:30 to 5 p.m. this afternoon here at San Juan College is when the State Health Department will be out there testing. Again, we have not heard that that's been moved or postponed. I assume they're still out under the tent, even in the inclement weather.
Yeah, it's like the Postal Service.
I would hope so.
Yeah.
I would hope so. Next testing schedule is Wednesday, November 11th from 8 a.m. to 9:30, and then Friday morning, November 13th from 8 a.m. to 9:30. So that is the plan.
Good.
So there we go on that. So,
Double dipping today.
yeah.
on Monday.
Yeah. So that's the plan.
Cool.
But anyway, and then we could look at some of the other numbers as we wait for our first guest. I know you like talking about the Johns Hopkins numbers.
Yeah.
So let me get to those as we click through and see where I put them. Come on.
There we
There
go.
they go. There we are.
There's
See?
the ticket.
That's it. All right.
Oh,
Here we are.
right.
And these are new. These are updated, I can assure you.
I can assure you too, because they are consistent with the numbers that I heard this morning.
Okay, good.
So see,
there you go.
we here at KSJE we do
have-
fact check ourselves.
Yes, we have a check and recheck.
That's right.
That's maybe.
Checks and balances.
That's us.
That's us.
Okay.
Okay, so U.S. confirmed cases, we're almost at 10 million. We're at 9,975,500. U.S. confirmed deaths, we are at 237,587 deaths. And notably, we have almost 100,000 positive cases a day in the United States, which is the highest rate of infection ever since this whole debacle began.
Right.
And we have about 1,000 deaths a day in the United States. So it's sobering.
Definitely.
That's a lot of people.
Right. And shows no sign of slowing.
Not right now.
That's the issue. So that is the problem.
But we got Pfizer on the front line, so I'm hopeful.
Yes. Me
So
too.
yeah, so
there's that.
of course, India is right behind us, and Brazil is right behind them, and that's been consistent throughout. Although, look at this, France has moved ahead of Russia. That's new.
And the number of cases.
That's
right.
new. Yep. That's
well,
new.
we've seen the increases in France.
In Western Europe.
That's right.
France, Germany, Britain.
Right. And the number of deaths, again, as you mentioned, we're still leading the rest of the nation, the rest of the world.
American exceptionalism.
Yikes.
Yikes.
But you can see U.S. at number one, deaths in Brazil, India, and then Mexico. I think Mexico hasn't been the fourth one.
Mexico has dropped.
So
Yeah, but France is notable. That's new.
the cases
So,
on the
yeah.
other column. Gotcha. All right, let's take a look in New Mexico. Again, we are still in the quadruple digits for new cases every day. 1,214 reported yesterday, for a total now of 54,881. San Juan County, yesterday's numbers were actually pretty good, up 16, and I say that all things withstanding, because I think on Saturday the numbers were like 70 plus. So the weekend we had almost 100 new cases in San Juan County. We're now at 4,112. 14 additional deaths in New Mexico reported yesterday. That includes one person from San Juan County. So we're now, for the county, deaths above 206. And there were 117 new recoveries reported yesterday for a total of 23,205. So we appreciate those numbers as well and celebrate the recoveries and more in the fatalities, because it's a tragedy for sure. Other news stories that we want to share with you from the Navajo Nation. They had 124 new cases yesterday. That has, again, been high. They've been reporting above 100 cases per day for the majority of the last several days, last week or so that we've been watching them, of course. Their total number of deaths, they had 2 additional deaths reported on Sunday for a total of 593. So 124 new cases for a total on the Navajo Nation now of 12,571 cases. So there's...
Also a sobering number.
Yes, very much so. And again, their numbers are high like everywhere else. And so the curfews have been reimposed for the weekends and, as they try to get a handle on these. And the other notable story that I put up there that I thought was worth sharing was the Farmington schools have decided to close an entire elementary school for 1 week this week because of the number of COVID-19 cases being reported among, I believe, staff and students
Right.
at that school.
Right.
And of course, that's just down the street here on College Boulevard.
Right.
So, so there is that. But I know, again, the school district's been very transparent in releasing whenever there's a positive case of a student or a staff member, whether or not they've been in contact with anybody else, they still put it out there.
Right.
So there is that. So that's what's going on. So I think that's all the numbers I had to share with everybody.
Okay.
So yeah, it is, and it is. So there you go. So we're waiting for our guests to call in. In the meantime, we can talk a little bit about this watch list
Sure.
that we will be talking about here in just a moment. And
Well, I mean, the big news over the weekend, of course, was the Walmart in town. Have both Walmarts closed or just West Main?
just west.
Okay, so the West Wayne, jeez.
It's
I didn't do
it's
my
catching.
vocal.
It's catching.
I didn't do my vocal warm-ups this
That's
morning. The West Main Walmart was closed for a temporary amount of time to do some deep cleaning, which of course that's a lot of square feet to deep clean.
Yes.
Because they had 10 positive cases amongst the employees there. So that's notable news, which of course relates to this watch list, which we are going to hear more about it. But basically the idea is if you have 4 cases of COVID-19, then you're within 2 weeks, then your establishment is closed for 2 weeks. And
Right.
that's the rapid
That's-
response team.
Exactly. And that's why we've got Maddie Hayden on as a guest here in a few minutes to talk a little bit about that system and how that works, because there was some confusion originally when Walmart closed, and I saw it on Facebook, a great source of information.
It's not necessarily a terrible source. I don't know. They have.
Well, it was not an official source, is what I'm saying. There were the people
Right.
that thought they knew what they were talking about,
Right.
as we tend to find sometimes on social media. And so there were some folks saying,
Not just
no.
social media, but that's another
Well,
human
life.
behavior thing.
Okay.
Yeah, yeah.
Okay, I'll go with that.
Yeah.
But some folks were saying, oh, no, it's only closed for 2 days. Don't worry. We just made a delivery there of liquor or whatever it was, and they'll be reopened on, Sunday, Monday.
Right.
And then, of course, it's not true because
Right.
they are closed now for 14 days.
Right.
Is what has happened because
Right.
they're on this watch list, and that is what the state has been putting out. This is all, again, public information, everybody. You can go to the state, the Mexico Environment Department website. They're updating this on a daily basis, and basically, if a business has 4 positive COVID-19 cases, they have to shut down for 14 days. As you can see on the screen, the Walmart Supercenter on West Main has had the 4 cases. The other business on that list today is JCPenney, and they had 2. So they are not shut down, but they are on kind of notice because it's, I think, 4 cases in a 2-week period. So if they get 2 more cases, they will again need to shut down as well, and others come and go off of this list. So it's worth maybe paying attention to, and the state is again trying to share that and trying to get a handle on the numbers.
Yeah.
That keep going up. So that's what we're waiting on to talk to Maddie Hayden about here in a minute.
While we do that, there has been news just this week about the success of Cornell University in containing COVID-19. Have you read up on this?
I have not, but I'm assuming you have.
Of course.
So because you're bringing it up.
Well, yeah. Of course.
Yeah.
Anyway.
So what do they do?
So their success is based on pooled testing and contract tracing programs. And pooled testing, that was something that in the beginning we heard a lot about, and we haven't heard an update really on pooled testing lately. But that's the idea is that you just kind of like amass groups of 10 and you just test, and that yields usually a faster response because you can test them all at once, and then if one comes back positive, then you have to retest everybody and be a little more specific, but that would be pooled testing. And then, of course, the contact tracing is very important. The quicker you get on that and you start isolating and quarantining folks that have been in contact, the better off you are.
Right.
And so they kept their infection rates really low, and they are not strictly online. I mean, what's notable about this case is that they have in-person instruction. And
Right.
and
on campus
housing,
right,
and,
with people living and dining and being there.
Yeah. So you'd think it'd be a petri dish, but somehow the way that they are running this is pretty extraordinary. They've had just 10 cases over the past 2 weeks, and that's a campus community of 9,000 faculty and staff and 19,000 students.
Wow.
So we're not talking
Yeah.
about small numbers here.
No.
So so that's very notable, and part of it is they modified their classrooms and their dining halls and study areas. So of course you're to be very meticulous about the social distancing stuff. They upgraded their ventilation system, which I'm sure cost a ton of money.
Right.
Mandated mask wearing all over campus. And just created a public health campaign, which includes students they were required to sign a behavior compact. That's what they're calling it.
Okay.
Behavior compact.
Interesting.
And they have
That they
mechanisms.
they would do certain things and wouldn't do other things. I
Yeah,
suppose,
like
right?
you're not going to have a kegger.
Right. Well, at Cornell, they don't do that, do they?
Of course they do. What? No,
Come
no
on,
university,
Cornell.
no matter how elite,
Come on.
is immune to
Oh.
20-somethings that want to
Disappointing.
have those. So,
Okay.
and then so they
couldn't do that.
They couldn't do that because they actually they set up mechanisms of consequences.
Sure.
So this is
And
good.
if your parents are paying for you to go to Cornell, you don't want to waste that money.
No, although I'm sure they
And
often
get kicked
do.
out.
I'm sure they often do.
Yeah, true. But anyways,
That's
but
another
it's a
human
special
behavior
year.
thing.
I guess
Yeah.
that's true. But yeah,
Yeah.
there you go.
So-
Interesting, but good for them.
Good for them. Shout out to Cornell. Not that they're listening, but
How do
shout.
you know?
That's true. You never know who's listening.
We never know.
We never know.
That's true.
We had that Hawaiian listener there for a while.
That's true.
Where'd he go?
He may still be out there. I don't know. Let's
He
see.
used to say aloha all the time.
Right?
Yeah.
Well, I don't know. But come back if you're there.
Come
Yeah,
back.
there you go. Anyway.
We miss you.
Exactly.
So they are testing more than, get this number, this is the last notable thing, they're
Okay.
testing more than 30,000 individuals per week.
Wow.
That's insane.
No, Cornell?
That's a lot, yes.
Wow, that is a
Cornell
lot.
themselves.
Yeah.
That's like almost the whole campus if you have 9,000 faculty
Right.
and staff and 19,000 students.
True.
Yeah, more than 30,000 individuals. So, I'm sure that their endowment is gigantic and good for them for
Yes.
using it on public health concerns.
Well,
So,
sure.
Yeah.
That's
Not new basketball uniforms, but testing.
Yes. Well,
I mean, nothing
This-
against basketball, but
different priorities this year,
yes.
I'm afraid. So there you go. Excellent.
Cool.
So we have a guest who's calling in, and
we
let's just see who is on the phone. We'll put them on here. Good morning. You're on KSJE. Thank you for calling in this morning.
Good morning, Scott. This is Maddie Hayden with the Environment Department.
Hey, Maddie Hayden, thank you for calling in this morning. We appreciate it, and we're so grateful for you for calling in to talk a little bit about the watch list. We've been talking a bit about that this morning, and maybe just to bring everybody up to speed, this is kind of coming out of the governor's public health order back on October 23rd, right? This is kind of what got this watch list into practice?
Correct. So we launched the watch list that week, and what the watch list shows is businesses that have seen 2 or more rapid responses within the last 14 days. And just for some context, what a rapid response is, they're initiated by the state when we learn of a positive case among employees in a workplace.
Understood. And so with that being said, then once that happens and they get 4 in a 2-week period, then that's when the state moves in and says you need to shut down for 14 days. Is that what triggers that?
That's correct. If we see 4 or more rapid responses within the last 14 days, we will consider ordering an establishment to close.
And so when you order, and this is Megan, by the way, nice to meet you virtually, and when you order an establishment to close, is there also some sort of like follow-up where a team comes and investigates what could have been done better, if anything, or suggestions to prevent this going forward? Is there follow-up like that?
Yeah, sure. Hi, Megan. So, during a rapid response, a part of a rapid response is guiding establishments through, what their procedures are, what they could be doing better, as well as, helping them decide who needs to be tested and who needs to be isolated and quarantined. So that's all part of a rapid response process. When we do issue these letters, these closure letters to businesses, we also encourage them to use that 2-week period to have all of their employees tested.
And do we have a number on how many establishments have had to close down since this program began?
We're currently at 8 around the state.
Gotcha. And so you mentioned that if a business has 4 positive cases, then it would be the department's discretion to order them to shut down for 14 days, or is that an automatic shutdown? I was a little unclear on that.
Sure. So let me just take on the first part of your question.
Okay.
Just each rapid response may involve 1 or more positive cases. So that's just something to consider. It doesn't necessarily mean that there are 4 cases. There could be more than that. And then the second part, this effort, the closure requirement is really focused on retail spaces, hotels, restaurants, close contact businesses, which include like gyms and spas, places like that. But the public health order also allows the state to have discretion in determining, requiring an establishment to close based on the level of public health risk.
I see. And would the essentialness of that business, I can see maybe if I'm in a small town and we have 1 grocery store, that would be bad to have that shut down for 2 weeks. Is that kind of what we're talking about, to allow you that discretion?
Yes, absolutely. It allows us to consider establishments that aren't on that list that I just detailed for you. But right, it also allows us to consider if, for example, a business is a sole provider of goods or services within a community here in New Mexico.
Great. And regarding the number of 4, is that just based on the rate of infection, or where did 4 cases come up? Because you could have chosen any number of cases.
Sure. Right. So we looked at how our data was panning out as far as how many businesses were within that 4 and within the 2 to get to the rapid response watch list. And ultimately decided that was sort of a good amount to make it sort of a precision tool, where it's not forcing, most or all businesses to shut down in the state, but is allowing us to determine where there's a problem and if it's necessary to close that establishment.
Understood. And Maddie, Hayden, I would assume then this is obviously designed to work in concert with the other public health orders to try to tap down some of these cases that are increasing across our state, or at least try to get a better handle on where these outbreaks are maybe happening, so that we can try to control the spread in these communities?
Absolutely. It's intended to not only stop spread in workplaces, but we all know that there are customers that go into these businesses. Employees have families that they go home to, and so it's really designed to help aid us in stopping the spread that we're seeing right now in New Mexico.
Understood. And this all started, kind of the tracking and the counting started on October 23rd, and that's why we're starting to see some of these closures, I guess, now after this 2-week period, right?
Yes, that's correct. We started counting toward the 4 on October 23rd.
Gotcha. Very good. Well, Maddie Hayden, we appreciate you calling in this morning and talking with us. A very important, topic, and this is kind of what all businesses are dealing with, is working with you and with the Environment Department and reporting these positives, right, when they come in.
That's right. Employers are required to report to the New Mexico Environment Department when they learn of a positive case in the workplace within 4 hours.
Gotcha. And so far, most have done that, or anybody needing a little reminder, or everybody being good with that?
You know, I think it's always good to get that word out there about that. You know, we do as much outreach as we can, and we certainly, you know, remind people as often as possible that is a requirement at this time in the state.
Great. Thank you for that reminder. And Maddie, thanks so much for joining us.
Okay. Thank you so much. Have a good day.
You too. Thank you very much. Very good. Well, that helps to explain what that's all about, right? That watch list is new, and so
it is.
And
you hear like watch list, and you're like, oh my god! Like I always,
right?
I think like FBI watch list or something.
Well, you're on that too, probably.
I am on.
I bet you're on that too.
That's right.
Yeah.
Yep.
You got a whole file. On you.
We got many a file.
Oh yeah, that's it.
All around the nation. Anywho,
there you go.
Looks like Mr. Bourgeois might be joining us.
Let's find out. Good morning. You're on KSJE. Thanks for calling in this morning.
Well, good morning, Scott. This is actually Dr. Bob Underwood.
Dr. Underwood back with us. Thank you for calling back in. Thank you. Good to see you. Chief of Staff from San Juan Regional Medical Center, and we just wanted a little update on numbers this week. We talked to you on Thursday, so what's changed since then? Anything?
So, yes, actually. So our numbers are continuing to climb. Overall, we currently have 33 patients that are COVID positive in the hospital, 2 that we're waiting for tests to come back on. We have 2 patients that are in the ICU that are currently on ventilators that are COVID positive, and the total in the ICU right now is 9 patients. Only 2 of those are on ventilators, and we have 14 beds in our ICU. We also have another ICU that we have established since COVID started, and currently there are 7 patients in that ICU out of 9 beds there. So the numbers definitely are going up, as we're seeing in the rest of the state, as we're seeing in the states that are surrounding us.
Great. And hey there again. So great to have you on. I want to ask, and real quick, and Scott, maybe you can leave the numbers up for a second. Testing numbers. Just okay. All right. So I was just looking at the daily statistics there, and I want to make sure that I'm interpreting these correctly, because you have over 15,000 tests have been administered, and over 14,000 have come back negative. And are we to read that as a real positive thing, that most tests are coming back negative?
And let me just add, Dr. Underwood, we're looking at the San Juan Regional dashboard from your website. That's where we're getting this.
That's where I'm getting this. Yep.
Right. And Megan, the answer is probably not, because the more contemporary data, like the information that we're getting more up to date, our most recent statistic is we're getting 13% positives of the tests that we're doing. That's a 7-day rolling average. So those are just the tests that have been done in the last 7 days. So our percent positivity rate is really going up a lot. And so what we tend to see is, as our number of positive tests go up, 2 weeks later, 10 days to 2 weeks later, our hospitalization rates go up, and then our ICU utilization goes up a week or 2 after that. So what we're seeing is concerning for what the near future will hold.
Yeah, and that is a significant increase, because I remember that number being in the single digits early on in this thing. So follow-up question just about, there was a big anticipation about the second wave come winter months. And is this related to, I'm sure there are multi-factors, and one of those things is that people are spending more time inside, et cetera, but are viruses also just more virulent in the winter? Like, what's going on there with this one?
So a number of factors that, of course, play into it. Naturally, the proximity of people to each other plays a big part of that. So the ability of the virus to spread from one person to another does go up if you're not spending all your time outdoors and you're in close quarters more often. So that is one of the factors. There are other factors that play into it, that there are theories about higher heat does make the virus less replicatable or kills it before it can be transferred to another person. So your question about whether or not the temperature variations from the from the weather changes has any impact. It's not proven, but it does happen with some viruses, and so we don't know for sure about the COVID virus.
Interesting. And Dr. Underwood, I had a question about staffing. I know, as we see an increase in cases, and the hospital has kind of been preparing and kind of being as flexible as you can to offer additional beds and things along that line, and even overflow capacity if needed, and that's great. But then the other concern would be, is there staff available to deal with this increase in patients? And is that something that your team is working on there at the hospital, or have you already figured out a solution to that possibility?
We have plans, alternative care staffing, or alternative models to staffing, certainly. And we implemented some of those in our last big surge that we had. And we're not even to the numbers that we were seeing back in May, June timeframe. Nonetheless, we do have plans for alternative staffing depending on what the needs are. Now, we don't know how bad this is going to be. And so in the end, you're right, we don't know what the overall staffing needs are going to be. It depends on how bad the surge really gets. So we have planned for it. We have models that are built out for it, but whether or not we're going to have to implement them and to what level, we don't know. But if you read the literature across the entirety of the country, everybody is dealing with that. Is that, yes, we have beds, yes, we have ventilators, yes, we have medications, but it's the people who have the specialty, the training, and the knowledge base to treat all of those that actually ends up being one of the rate-limiting steps.
Very good. And, as your colleague Brad Greenberg has told us, 1 ounce of prevention is better than a pound of treatment options because these things are evolving. We have some concerning news from El Paso about the 4th mobile morgue being established down there. Now, granted, that city is way, way larger than we are in our part of the world, but, is this like some sort of herald that this is coming our way at some point?
Yet to be determined. We don't know for sure what it's going to look like in the overall scheme of things, but that's not the first place that has been implemented. We actually just recruited a provider who was in the New York City area back when they were having their really bad time, and they have shared some interesting stories that are similar to that. Mobile morgues being set up because of the death rate that they were seeing. Now, are we going to see that? We don't know that for sure, but it's something that we definitely need to pay attention to. So it's happening in El Paso. I will say also that I read an article over the weekend that Utah is starting to talk about their utilization of ventilators and bed space as well. And whether or not they're going to have to have enough to go around if it continues on its current path. We're not at that point either, so that's kind of opposite ends of the spectrum for us down in El Paso, one end of the state, and then in the Salt Lake City area, the other direction. And so, again, we don't know how buffered we will be from that, but again, we're planning for it, and we're looking at what are the protocols we would put into place should that arise.
Certainly, but I guess a good reminder, though, of how this is spreading in our neighbouring states, and certainly El Paso is really, Las Cruces and Doña Ana County is really just suburban El Paso, so there's got to be an influx and a definite impact there. But we're so grateful that you are planning for this unfortunate possibility, but we're hoping, again, if folks are paying attention here in San Juan County and throughout the Four Corners, that we don't get to these numbers and our numbers start going back down. And again, nobody wants to overwhelm our hospital because, and you have stories, I know, Dr. Underwood, from those peak times back earlier this summer. So nobody wants to go back there anytime soon.
Right, absolutely. And, there are good things on the horizon, too. New York Times reported this morning that the initial studies from the vaccine from Pfizer, which is the first one that we anticipate will be distributed, has a greater than 90% effectiveness, which is really, really strong. I haven't read any official peer-reviewed literature on that yet, but if that's a preliminary result, we couldn't have asked for something better than that.
Well, yeah, and that is very positive news, and we're all looking forward to that and hopeful that continues to move forward. But Dr. Underwood, we appreciate you calling in this morning with the update. I think it's important just to hear from folks who are on the front lines like you are. So thank you so much for sharing what you have learned and are sharing with our audiences today. Thank you.
Absolutely. Thank you, Scott. Thank you, Megan. I appreciate your time.
You're very welcome. Always great to talk with you. Dr. Bob Underwood, the Chief of Staff over at San Juan Regional Medical Center, who's calling in live this morning on KSJE. So thank you very much. So good information.
Yeah, good show with lots of information, I think.
Yeah,
today.
very, very true. So I think, the takeaways are to keep keeping on. These numbers are not going down. And so, we just need to keep distancing ourselves and washing our hands and not touching our face and limiting our contact with other folks.
Yes.
All those things that we've been talking about, unfortunately, but here we are, week 35.
Yeah.
And we're still talking about
and
it.
Unfortunately,
and we still need to talk about it.
We have like this inverse correlation going on where apathy is going down as cases are going up. We want to reverse that.
Right.
Both of, so that's a thing. Or sorry, apathy is increasing while cases are also increasing.
Also
and
increasing.
We want to invert that.
That's
and have
what
the
we
apathy
want
go
to
down.
do. Right.
Anyway,
what do you got?
So yeah,
we're going to wrap up on a positive.
Let's wrap up on the positive story because 4 mobile morgues is a little terrifying. So, so let's talk about the beach, Scott.
The beach.
Are you a fan of the beach?
Love me some beach.
Do you?
Sure.
I'm not a huge beach fan. I feel like
here in New Mexico, it's all beach. We're just missing we got lots of sand. We're just missing the surf.
We're just missing the water. Yeah, I think that, I don't like the beach because I feel like a glazed donut every time. I'm like lathered up with sunscreen, and then you mix the sand, and that sand never leaves you for like 3 weeks after you get by the beach, like from the beach. You have
okay. All right.
I'm getting a little too excited. Okay.
Yes.
Okay.
So that's your
anyway,
beach
the
problem.
point is that's my beach problem. But the beach is relevant because a hospital in Barcelona has started to take advantage of the shore. They are now wheeling out recovering COVID patients for some short breaks near the ocean.
Oh, nice.
Isn't that sweet?
I like that.
I mean, I feel like that's a very innovative, creative, compassionate way to go.
Sure.
So way to go, Barcelona.
Right. Way to go for healing and recovery.
Yeah. That used to be a big theory too.
That's great. Well, at our hospital, which I'm sure you have seen, when they renovated San Juan Regional Medical Center and built that new tower, part of that design was that big healing garden, which is in that kind of semicircular area. And I'm sure the hospital, when it's appropriate, can do that with some of their patients as well. And I think balconies are part of some of the newer patient rooms to get outside in the fresh air. So
right now, I think the balconies are closed because it's like an extra step in cleaning, but
it might be.
But anyway,
something to ask our Dr. Underwood.
Let's ask.
He's not there.
We'll ask. Yeah, Dr.
He's gone.
Oh, he's hung up. Which
That's right.
is.
But anyway,
he probably heard the beach talk and was like, "Okay, we'll just let these jokers keep going."
Yeah.
So anyway, we'll be back Thursday, audience.
We will be back on Thursday, everybody, and hope you will be too. So thank you for watching and listening, and again sharing with your friends and networks. And we will see you in a couple of days. Stay safe and stay well, everybody. Bye bye.